and they're like, what is
Never heard of
this
sugar in
yoga?
your soil.
Okay, so most of the time, the people
Control
that
your
they're
emotions,
that
not
they've
break
been
under pressure.
painted
All this
is
stuff is
We are one of the very few
meditating with
businesses, organizations
you know.
where you
So
can shop
really
Great
online.
tips already off the bat, and we're just starting.
Go to Top Box.
Hello and welcome to Healthier Habits, a podcast that discusses challenges and solutions when it comes to health and wellness, as well as connecting you to some local resources in Chicago. My name is Cassandra Zumba.
And I am Yakwache and will be your host. We are the Policy, System, and Environmental Coordinators here at the Chicago Partnership for Health Promotion, a program from the Office of Community Engagement and Neighborhood Health Partnerships at UIC.
Today, our special guest is Barbara Hernandez, an administrative assistant for CPHP for the past 15 years. She holds a bachelor's degree in business management and a minor in human resources from Robert Morris University, has had over 26 years of working with nonprofit organizations. She believes in the principle of practice what you preach, which guides her approach both personally and professionally. Whether it's administrative support or following the Healthy OceAN-HP guidelines, she strives to lead by example and uphold the values she advocates.
And I just want to add that Barbara is the go-to person. There's nothing here that gets done without Barbara. So she is the most valuable person here in the organization. Yes. So if you need anything, she's a go-to person. And if you're like me, you just go and bother her once in a while.
Get her to print you something.
Welcome, Barbara. Thank you for being here.
Thank you for having me.
I know you're so excited to be here. I'm glad that we were able to sit you down. So we mentioned in your bio that one of the things you like to see is practice what you preach. So what's one of those examples of practicing what you preach in your personal life?
I take a great interest in being a good role model towards my family. So I have taken it as a personal stride to teach my family how to properly read food labels. So I've also encouraged them what not to eat and what to eat, replacement, like pretty much everything that all the NPEs and the ICs and the HESs teach about. I take a lot of that information back home and I put it on the refrigerator door and I make sure that all my family gets a copy. So on holidays, we switch it up. Instead of fried food, we do baked. I do salads every summer event with my family. I always bring a salad. I don't bring anything sweets. No more of that Dunkin' Donuts and pastries. No more. And I started doing fresh waters. So I do what do you call that? Strawberry and a kiwi and mint waters instead of pop.
Okay.
But yes, that's what I've taken that strong initiative, especially with the younger. And with my niece and nephew and my son, of course.
Yes, it's a process. It's just a learning curve for everyone. I mean, and that's a true success story to hear someone say that they took what they learned and spread it to their family. Because again, you can teach one person one thing, but word of mouth kind of just helps out, because we want to reach to more people.
And I'm glad you mentioned that the younger ones, because we had an episode where one of our guests mentioned that how kids, I guess your healthy habits or your health behavior starts when you're in the womb. So whatever your mom is eating is probably going to affect you later on in life as well. So it's good to, start eating healthy or doing the healthy habits when you're young, because that determines your health determinant when you become an adult and stuff. So I'm glad you mentioned that. You've been here 26 years.
I've been here 15
years.
Come November will be my 15th year.
15. That's a lot of years. Give us a little, about the experience at CPHP, why you even came here, and what actually led you to stay for 15 years.
Oh, okay. I like what CPHP does in the community, what it advocates for, promoting healthy nutrition. I was never a person who even considered it when I started. I was those kind of, I guess you could say, run-of-the-mill, I would get up and go and work out, and I would eat whatever I wanted to. But as I got older, I realized that wasn't that wasn't going to be completely all I had to do. So I had to change my habits, and I have done that. I've hit a bump here and there. We all have done the yo-yo dieting, but every year I think I have learned to better myself in my health, and I might be very curvy, but I'm very healthy. That's what I always say. That's what counts. I do get my blood work done every year. I get a checkup, and I'm healthy as a horse. Other than a little hip pain here and there, that's for just getting old. But that comes with age.
Yeah, I mean, I think that's important to point out to the people that it's not about looks all the time. It's what it is internally. So making sure you're just checking in with a doctor, getting all your blood work done, staying with those healthier habits, exercise, all of that it may not always translate as you think it should, but sometimes it is. Everyone has different body types and everyone looks different. So just because one person looks like one thing and another looks like another doesn't mean one is better than the other.
Exactly.
So it's just not comparing yourself either sometimes.
Yeah. And I've also learned that here at CPHP, food is nutrition and food is very powerful. So it's how you approach it. Like greens. I don't even remember eating greens until after I got here. I used to occasionally have a salad here and there, but when I started with CPHP, that was like my go-to. Like, ooh, I think I can get too used to this.
Yeah.
And not too long ago, a few people asked me, would you ever reconsider doing plant-based? And I was like, you know what? I probably would. It would take me a bit because I love chicken and but I've already eliminated the red meat from my diet. So, and that was just this year alone. So I'm getting used to it. I'm missing the bacon and the burgers, but it's getting used to, and I know that I can follow through, especially if it's to improve my health.
I don't think I have the discipline to go like any kind of pescatarian, vegetarian, although I don't think I have that discipline.
Food is powerful. It is. It's especially the way you present it, the way you cook it. It's just very healthy. It's the fuel that we need to wake up and do everything we have to do for the day to strive for our goals and come to work.
So being an administrative assistant for 15 years, you've probably seen so many things come and go, change over the years. And one thing we wanted to talk to you about is like healthy catering or the wellness policy. We know you weren't like the head of it, but you were there to witness it. So kind of just give us a little rundown of what people were thinking, what you were thinking, like just how it happened or how it was approached or how it was just brought up.
Sarah Richardson, she used to be intervention coordinator with us a few years back. She is the one who actually introduced the main points as to why we should adapt healthy guideline or policy within our department.
Yeah.
So she was the brainstorm, and she got a group of us together, and she pretty much assigned everybody what was the main factor of the guideline. So I got the catering.
Okay.
Obviously, because I'm the one person that has the key card and T card, so I'm the person who has to order everything. So
Money.
she gave me that task, and I was more than happy to do it. So what I did is I went out. I mean, I didn't do any test tasting. I wish I would have, but I did, look around. I did research online. I even went in personally on my personal time and went and looked for some mom and pops bookshops, keep it local.
Yeah.
And so I branched out, and I did find 16 that offered healthy options. They have a full menu, but I like the fact that most of these caterers did offer, well, I could say 75% of them offered a healthy option, especially because we do have vegetarians staff and people with, it's the word I'm looking for,
restrictions.
Yeah, dietary restrictions. So,
How did you land on that number? Was it just
16.
Yeah. Was
No.
it just let me look at anybody distance or did you have a goal?
The goal was to have a variety of different type of food vendors that we could select from, so that if, we can just populate, like, let's say, for instance, once a month, we could try one vendor. And so that was one goal. And the other goal was all the different type of foods, from American, Mexican, Chinese, Jamaican, a variety. We just wanted a list of variety of foods. So that was the second goal. And I think I might have aimed for less than 16. But and I read reviews and everything. And I made notes on the guide. I made notes as to what they're renowned for, what they're better known for. If they deliver, if they don't, if we have to pick up, if we could do it online, if we have to be in person.
And that's great details you're giving, because at some point you're going to be like, oh, I can just like search it up on the phone and just pick one.
Right.
But there's other things like, do they deliver? Do they accept this? Can I get to there? All those little...
Oh, yes. And
add up.
Do they accept tax exempt?
Yeah.
My favorite.
Yeah. So it's not only just like that one question, where do you want to eat? It's like, what kind of food do you want? What do they have? Can they accept this? Like, there's a lot more work into it than just finding names of places.
Yeah. How did people respond to it?
At first, maybe the first couple of meetings, we did have a little hesitation, except for the vegetarian. He is totally enjoying it. But as for the rest of the staff, maybe there was a handful of staff that weren't too keen about quinoa or what was it called? IDOF. I forgot. I just remember the initials. It was a Mediterranean cuisine. So some people weren't. The vegetarian was really into it, but the rest of the staff, some of the staff were like, oh, can we do something else next time? And it's like, okay. So what I like to do is that, let's say, for instance, if we do have staff enrichment, I normally ask my director if he wants me to select or if he wants to select. So what he'll do is he'll either pick or he'll have me ask someone to pick. Catering food for a meeting, that's a plus.
It is, but it is a lot of work. I mean, there's thought to be put into it.
Yes.
Sometimes it's different between when it's just like a small staff meeting or that you have to order for a whole conference.
True.
Yeah.
Recently, we had the Hunger and Health Conference, and we had over 100 people. So the catering was a little different, but we did try to stick with the guidelines, the healthy guidelines. But unfortunately, we were asked to do sandwich boxes. So I was going to opt out the chips for fruit, but then we were told to just order more, just to bring food. I mean, fruit in.
Oh, okay.
And just pretty much he just wanted everything to be grabbed, like easy access, just go and pick up and sit down and eat and go back to the conference. So that's pretty much the ballpark.
Yeah, that's the reality that sometimes you just got to adjust on the fly.
Yes, adjust on the fly.
When it's a written policy, it sounds great on paper. And when it's with a smaller group, maybe more adjustable. But once you have to expand it, you either have to revise whatever you have written or just kind of adjust, and just make, the best options available. Again, sometimes we go to locations that are kind of remote as well. So something that's being able to transport easily is very important.
Yeah.
Keeping cool, all of that, all those other health guidelines that we also have to consider.
Yes.
Yeah. So what kind of updates do you think could be made to the wellness policy, or maybe your list of vendors?
Oh, definitely the list of vendors. Because this list is 4 years old. So I'm pretty sure with a lot of vendors maybe going out of business, who went out of business because of the pandemic, and then all these new pop-ups because, recently we've had a lot of new pop-ups where new restaurants, not technically, not necessarily all of them cater. They don't have catering menus. They just have your basic menu.
Right.
So that's another thing, but definitely we do have to update it. So it might be less than 16 listed vendors, or it might be more. So we'll see. Soon to find out.
You're a little more versed on the policy than we are because, again, that was implemented 4 years ago. Our rate...
Oh, 6 years ago.
5, 6 years. Even
no,
time.
I'm sorry. Let me take that back. It was created in 2018.
Oh, there you go. 2018. So now we're a few years down the line now. What do you think should be maybe adjusted, or what do you think we should add? Is there something missing that you feel that we should kind of take a look at again? Other than the list of vendors.
Other than the list of vendors, we could definitely incorporate the eatmovesave recipes. Because before that, because eatmovesave didn't exist before that. So that's definitely something that we can add on here. The recipes, obviously make it more, make it digital.
Thank you.
So that, staff can be familiar with it, the policy.
Yeah, we had a conversation with Catherine, and she was saying how some things in organizations are done, but they're not written down. So not necessarily that we don't use our eatmovesave recipes because we all use it in a different version. We just haven't officially jot that down, So we need just to officially upgrade all the technical aspects. But a lot of the things that we've been doing has been implemented, but in an individual basis and not as often. I think we need to work on, again, just to give it a quick look, add different opinions, the newer opinions, and see what else.
By the newer staff.
And see, what else can be adjusted. But again, the pandemic really kind of shifted everything.
Exactly.
So just going back, some things are could be relevant, isn't relevant. Some things we couldn't even predict at that point. So it'll just be nice to kind of get some fresh eyes out there.
That's a good idea and a good point, Cassandra.
Thank you again for joining us. Hopefully the audience are able to know and take away from, the list of vendors, making sure to, do your research, not just put anything on the paper, actually do your research like you did. Even went there in person, talk to them on your own time, which is going above and beyond.
Say you should get compensated for that.
So thank you so much.
Thanks for listening to Healthier Habits with your host, Cassandra Zumba
And Diakwachi.
We hope you enjoyed this conversation. Keep an eye out for more episodes and make sure to subscribe and hit the notification bell.
Here at CPHP, we have the eatmovesave Meal Kit. This is an e-commerce project dedicated to improving and resolving access to healthy and affordable foods through a meal kit, which is packaged and delivered directly to a family's home throughout Chicago through Tapbox. Visit our eatmovesave website for more information on meal kit ordering and delivery.
You can help support the podcast by liking, sharing, and subscribing, following us on our social media accounts on Instagram as eatmovesave Chicago, Facebook eatmovesave Chicago, and YouTube as UIC OCEAN-HP. Look for the podcast tab for more episodes.
If you'd like more information on partnering with our organization, head over to our website, cphp.uic.edu, and send us a message.
Thank you for joining this chat. Check out our links and resources in the description. See you next time.
Bye.
This institution is an equal opportunity provider. This material is funded by the USDA Supplemental Nutrition Assistance Program, SNAP. Chicago Partnership for Health Promotion is a unit of the Office of Community Engagement and Neighborhood Health Partnerships, representing a network of community-based interventions designed to improve nutrition and reduce disparities in outcomes associated with nutritional diseases, including obesity. CPHP provides high-quality, age, gender, and culturally tailored nutrition education in various venues across the city.
Eat, Move, Save.